Well, hello and welcome everybody to our office closing and opening forum, particularly around COVID-19 in the workplace. It's great to have so many people on board. It's great to have so many people who have joined up. It shows an interest in how our offices around the world in an ADRA context are considering and interested in how we open up and close down in the wake of the COVID-19 situation. And I just want to welcome everybody and also want to welcome my co-presenters and facilitators. There's a big team who are behind this forum, and we're really excited to be able to share this with you, not just in English, but also in French and in Spanish. And this is the first time we've been able to do such a thing, a forum, and also have it in 3 different languages, which is really exciting. So welcome to everybody who is participating. I just want to start with the forum outline, just to let you know how this will play out. I'm going to give a brief introduction, and then we're going to have a health summary by Josue Orellana and an HR summary by Corey Dowling. And then we will break into a series of breakout rooms where we will discuss some questions that we have put together on the topic, including questions that some of you have submitted in the pre-application and the registration process. So we have one group in French, one group in Spanish, and actually we have 3 groups in English. After those groups have spoken and discussed the questions for 35 minutes, we will come back to a combined plenary to summarize and present the main points which have been discussed in the breakout sessions. And then we will have a final wrap up. This is an opportunity for each of you to be able to communicate and discuss how COVID-19 is affecting the work that we are doing in an unprecedented way. And it came about as a discussion or a thought, really, that many offices at the moment in the ADRA network throughout the world are experiencing challenges considering whether to or when to shut, and then of course when to reopen and how staff would be able to resume some sort of normality in their workplace, whether that be in their office or whether that be in the field. So this is an opportunity for each of you to communicate with your peer network, an opportunity to discuss similar challenges between one ADRA office to another ADRA office. And that's one of the reasons why we've got the breakout rooms, to give you the opportunities to discuss with other ADRA offices, knowing that there's no really right or wrong answer, but so that you can make the best decisions for your own places of work and your own localized situation. This is in no way a direction for your office to open or to shut. This is merely a forum where you can discuss and meet with other officers so that you can feel better informed to make your own decisions. I'm going to hand over now to Josue, who is going to share with us some health considerations.
Thank you, Victoria, and hello to everyone. Let me share my screen.
While Josue is sharing his screen, I just want to remind you that if you wish to have the translation in French or Spanish, you will see an interpretation icon at the bottom of your Zoom screen. If you click on that icon, you will get the option to either listen to this part of the presentation in English or in Spanish, in French or English or Spanish.
Okay, so can you see my screen now, Victoria?
I can. It doesn't look like it's a full screen. Maybe if you click on the presenter, the picture of the computer
Hay
monitor.
se ven dos presentaciones ahí, dos láminas.
Okay, let me see. Let me do it again. Share it again. For some reason, it's scanning us. Should be. No, it's just coming as the entire screen. Tino, could you share from your end? Okay, thank you. Thank you very much. Yeah, something has messed up here. Okay, so I just wanted to make a few health-related considerations. We know this is a health emergency. And as Victoria already said, these are not specific instructions on what to do in every single case, but these are just some points for consideration in general. So we can go to this next slide. So the first thing to remember is that, and we already see this happening in several countries, and even inside the United States, in different states now, that COVID is coming in waves. You know, it increases, then it decreases, and it's coming again in some places. So depending on many factors, some of those factors are the social distancing measures that authorities are taking, and there might be other factors as well. So the implication of that is that we also may need to think about sometimes closing offices and starting teleworking and then reopening, and then maybe if the situation worsens again, we will need to close again, and so that is one of the things to consider. It's not just a one-time issue. It may be coming time and again for who knows how many months going forward. The other thing to remember is that there will be an underlying risk. No matter what we do no matter what measures we put in place, there will be an underlying risk until a vaccine is widely available in the place where you work, in the country where you work, and or a herd immunity is developed. That means that a good part of the community, of the population, a good percentage of the population is already immune, either due to being vaccinated or because they have been infected with the actual virus. We also need to remember that we are all learning every day about how to deal with COVID-19. So whatever we are discussing now and whatever we are saying now could change tomorrow. And you probably have seen that already. So far, how things have changed. Researchers are working very hard to bring about new knowledge, but things are changing by the day. So we need to keep in touch with local health authorities and with the local WHO office as well for updated guidelines. One thing to remember, especially as you go into working remotely, into teleworking, is to keep in mind the health of your staff, especially the mental health. That is one of the things that is sometimes neglected. So we have to keep that in mind. Can we see the next slide, please? So here are four things that the World Health Organization recommends when it comes to thinking about the workplace and COVID-19. The first thing is to incorporate simple ways to prevent the spread of COVID-19 in your workplace. Things like disinfection, like ensuring social distancing within your office space, things like environmental controls, like ensuring good ventilation, air filtration if necessary, and then the use of masks and all the other things. So that is one of the topics that you will discuss several of those things today. The other point is how to manage COVID-19 risks when organizing meetings and events. If you think it is safe to have meetings and to organize events, because the main recommendation, especially when the epidemiology is not going well in your place, is to actually not have big gatherings. But there are some recommendations given by the WHO as well about that. Things to consider when you and your employees travel. As you know, travel is one of the main factors that has contributed to spreading this virus. So, and that includes even local travel, if you travel by bus or in places where you are very close to other people, traveling to the field. And in the context of ADRA, we need to consider that kind of travel as well when we deploy our staff to the field to implement activities, and considering that we have to protect the health of the beneficiaries as well and the families of the workers as well. Another thing to consider is getting our workplaces ready in case COVID-19 arrives in our community. So, for example, when do we know if we should close the office, and if we have reopened, or if you have never closed, and then there is suddenly a positive case of COVID-19 within your staff? What do you do with that? How to react? There are some recommendations and some considerations to keep in mind about that. Can we see the next slide, please? Finally, this is something very important. There is no need to rush to reopen. If you have closed your office, you are teleworking, there is no need to rush to reopen, at least not before health authorities allow it. But even if health authorities consider it safe, there are a number of steps that you have to consider. Again, keeping in mind your local context, we cannot give global guidance in this regard because you have to really consider your local context, the local situation, and make your own plan and your own preparation before reopening. There is a link there that we will be sharing in the chat box as well to a document produced by the World Health Organization giving advice regarding the workplace, preparing the workplace for COVID-19. Thank you, Victoria. Back to you.
Thank you very much for that, Josue. And I just want to hand over now to Corey Dowling to do a similar update from an HR perspective. Thank you very much, Corey.
Great, thanks, Victoria. Look, good to be with you all. As Victoria and both Josue have said, just a very quick disclaimer as we walk through a little bit of HR information. Anything we're talking about here must be contextualized and interpreted within your own legislation, your own guidances, your own policy frameworks, because we can't give global advice here. You've got to really understand what's happening on the ground in your country office and understand what sources of information you're going to go to for information, and we'll talk a little bit about that in the next couple of slides. But just make sure you have a clear understanding of what your current policies are, any church policies that might exist, and very importantly, any employment or health country legislation that may have been updated since COVID came. If we look at, say, the United States or many other countries, Different legislation has been put in place since COVID has came. So just you need to make sure that you understand what your context is. So very quickly, we're just going to look through four elements that need to be you need to be mindful of, whether you're responsible for opening the office or whether you're part of that decision. The first one is you need to know your reality. And so that's the first point I want to talk about, is just understanding what that policy and the legislative guidelines are. Know what current policies are in place for whether it's teleworking. Hopefully, since a lot of you have already been teleworking, you've already reviewed some of those policies, or if you haven't had those policies, you've put them in place. But also specific changes in employment legislation that may have come into place since COVID has come. Make sure that your current policies are compliant with any changes in legislation. You really want to look for what guidance, particularly from the health authorities, as to what specific requirements might be in place if you are thinking of reopening your office, or alternatively, if you're either in the second wave possibly, or you haven't quite yet been hit yet. What guidance is in place for you to close your office? You need to understand all that reality around you as to what are the factors that you need to take in place to make a decision. What are the trigger points? This is really important that you understand beforehand. What are your trigger points to close an office again or to reopen? You know, because what you want to do is have a clear understanding of what you're looking for, so that when a decision needs to be made, you can make it quite quickly. So understand what are those triggers that that you're going to look for to be able to open your office, whether it's an edict or a guideline put out by the particular county that the office works in. For us in the US, we know that our trigger point is what the two main counties are where a lot of our staff live and where the office is located. So we look for obviously federal guidelines, we look for state guidelines, we look for the general conference, our parent organizations guidelines, but really what we're looking for our own trigger point to reopen is the county that we reside in, because within the US, the number of cases varies hugely amongst different counties. So counties are taking the decision as to when you can start to reopen. And I like that Josue made that point. Don't be in a rush to reopen an office. I think we've shown that we can adapt and adjust quite well to remote working. Whilever that works, whilever you don't have to have staff back in the office, I think that is really important that you find other ways of operating. And we'll talk a little bit about that on my final slide. The second element is relationships. And this is specifically looking at communication plan. I like that Josue mentioned that you need to be cognizant of the mental health of your staff, not just the physical health. This takes a big toll on all of our employees. The levels of anxiety and depression are very much a big issue right now, because there's a lot swirling around. There's a lot of information. People are genuinely apprehensive to go back into the office for very legitimate reasons. And so you need to have a strong relationship with your staff. Understand what are the concerns different staff might be feeling. And this centers around how do you communicate what you're going to do. So once you know your reality, you know what your trigger points are for opening or closing or adjusting, you need to have a really clear communication plan so that you can be very timely with communicating. You'll often hear the saying that never waste a good crisis. And it's funny, during this crisis, there's been a lot of positives that have come out of this. I think as a network, we've never been so connected because we've had to be intentional about communicating. I know as an office, we're more intentional about communication, regular, clear communication, single source communication, because you have to be more intentional about what and how you're communicating. And so it's important that you make sure that you know your plans for communicating. You've already, you know your reality, so you know what your trigger points are to open, to close, what guidelines you're going to follow. You then need to have a clear plan for how you're going to communicate those, being cognizant of how often you communicate. I know we're all zoomed out, we're getting updates, we're getting resources from every source. We haven't got a lack of information. What you need to do is channel that information so that your employees can trust the information you're sharing with them on a clear, concise, and timely basis. Make sure you use preferred methods. We know that not everyone reads emails. I've witnessed that firsthand. So make sure you use multiple methods to communicate. If you're going to send an email with guidance, follow up with a Zoom meeting, or just make sure that you're using the communication methods that are going to resonate and are going to send that message to your staff. It's important to have just a point person on communication so that staff aren't getting flooded from multiple sources. It just helps to have a real clarity of message, and make sure you are tailoring your communication for different levels. You don't want to overwhelm all staff. If there's key messages and concerning messages, you may want to filter that first through your supervisors so that your middle management team are understanding what the reality is, and they can then in turn share that information with their staff. Thirdly, we look at responsibilities. So it's really clear, you need to ensure that you have a scope of who's responsible for what. Obviously, your administration or your country office leadership may make the decision on the different policies that are enacted, maybe putting in place what the communication looks like, what sort of trigger points we're going to use as a starting point to either open or close an office. But then you've got to empower your middle management to know what their role is, because they are the ones closest to the ground. They know maybe a better reality than administration would know. So make sure your managers know what they can and can't do. What was the scope of responsibility that they have? If they have a team member who comes down sick, do they have the authority to quickly send that employee home out of the workplace or out of the work site? I think that's really important that you empower your management team to know what authority that they have, so that they can make decisions on the ground as quick as possible, because when we're looking at COVID-19, timely and quick decisions are really important. So make sure your administration and your management team have the authority to make the key decisions when and how they need to, whether that be implementing different policy decisions or whatever that scope is. But just make sure you have clear lines of responsibility for all levels. And finally, this is probably the most exciting element, and we often talk about this term, the new normal, because we know our workplaces have changed. They change very quickly, and we're still struggling to adapt to that. But as I mentioned before, never waste a good crisis. And I know it sounds quite callous to say that, but there are opportunities that come through a crisis. With the whole shift to teleworking overnight, it was difficult. It was difficult for employees, it's difficult for managers, but there's some positives that come out of that. You know, you suddenly have to be more intentional with communication. In the first few weeks and months, I saw more of my team than I have when we're in the office, because you're regularly checking in, you're ensuring that everyone is on the same page. You know, it's really important to work out what are those things that have gone well during this period, and let's hang on to those. Let's make sure that our intentional communication continues once we are back in the office. So everything that has worked well through this, you know, do an assessment, an assessment of what has worked well, what hasn't worked well, and you lose that. So, you know, one element with teleworking is that when you're managing staff, you need to focus more on outcomes. You know, too often we see supervisors that manage by if someone's in the office, then they must be working. If they're doing 8 hours a day, then they must be working. But that's not the answer to management. We want to see managers shift to managing outcomes rather than inputs. So it's important to know what has worked well and what has changed in the way we manage staff, so that you can keep those elements and then lose the other elements that haven't worked so well. So just very quickly summarizing, know your reality, know what your trigger points are to open and close an office, know what your policy infrastructure looks like, make sure you adjust and adapt those policies and make sure you communicate those policies or any changes to staff well, build those relationships to know how to communicate best so your message gets through. Align your roles and responsibilities for middle management so they know what they can, what authority they have to make decisions on the ground at the point of impact. And then finally, reinvent your culture. Use this as an opportunity to work out what has gone well in the last few months. Keep those elements. What hasn't gone well, well, let's move on from that, and let's make sure that our workplaces are as productive and as positive as possibly can. So Victoria, I'll hand back to you.
Thanks very much for that, Corey. And thank you also Josue, for your summary as well. And I actually really like your phrase, never waste a good crisis. So true, Corey. And I think that we have so much that we can learn from this unprecedented time that we have. So what we're going to do, everybody, is we're going to break out now into our breakout rooms or our discussion rooms, and this will be your opportunity to participate and to join in. We have that each of the breakout rooms will be recorded. So each of the facilitators are going to record the sessions in the breakout room so that we'll be able to share that later on. There are, as I mentioned, the translation options which are available. You have been pre-assigned into breakout rooms just to facilitate this process. If you, however, are somehow in an English language group and you want to maybe be in another group, you actually will have the opportunity to leave that breakout room and come back into this main room where we have somebody who will be able to assist you to go into the room that you want to be in. So both moving into the breakout rooms and coming back from the breakout rooms into this main room will be automatic. So you're going to be just directed automatically back into the room, so you don't have to worry about how you're going to do that. However, if you do get stuck, if you look at the bottom of your Zoom screen, you'll be able to see a red button which will enable you to leave your breakout room. But you shouldn't have to worry about that. As I say, there is somebody who's managing that for us. Thank you, Tino, for that. So yes, please enjoy. We're going to have a series of questions which I will just share with you. These will also be available for you in your breakout rooms. And I'm just hopefully going to share my screen. Successfully share my screen. And you should be able to see some discussion questions there, which you will also be able to see in your breakout rooms as well. So for those of you who have any questions, as I say, or want to swap into another room, you are able to do that by leaving your breakout room and manually coming back in, and Tina will help you out. For most of you though, you won't need to do that because you have already been pre-assigned into your breakout rooms. We actually have Corey is going to facilitate one of the English language rooms. We have Jason who's going to facilitate another one of the English language rooms. We have Reese who's going to facilitate a third English language room. We have Eric who will be facilitating in Spanish. And we have Rado who's going to be facilitating in French. So enjoy the opportunity to discuss these questions. They're not in any particular order. You don't have to, in your groups, discuss them in the order that they are presented. And we have 35 minutes to discuss the questions, so you may not get through all of them. And if you choose to pick one question over another and focus on that, that is absolutely fine. Enjoy, and I look forward to hearing from you when you get back and to hearing some of the summaries of the discussions that you've had.